I'm Mrs. Suchena Christine, the Deputy Director Admin and the head of department.
I am Ezigone Morin, Head of Nursing Service and Deputy Director Nursing, National Orthopedic Hospital, Enugu.
Yeah, my name is Dr. Charles Chijioke Agu. I'm the head of Department of Radiology, Nohe, Enugu. Yeah.
My name is Mrs. Honora Doris, the Deputy Director of Finance and Accounts, Head of Accounts Department, National Orthopedic Hospital, Enugu.
My name is Engineer Eze Dominic. I'm the head ICT Medical Illustration of National Orthopedic Hospital, Enugu.
Mrs. Helen Ibekwe.
Your office?
The PRO Public Relations Office, National Orthopedic Hospital, Enugu.
What is the hospital's expectation for today's visit?
Wow, well, this has been a long expected visit. There have been, it was supposed to come earlier, but due to some hitches here and there, he wasn't able to make it. But we are very glad that finally that the day has come, and we expect a lot of goodies from the hospital. In any way that whatever he brings up will help the patients and then the staff in general.
Okay, so what does today's event signify for this bones and plastic care?
Okay, today's event, we are waiting for the Minister of Health to come and see what we have on ground and to know what to put in place. Like our hospital is in dire need of medical resonance imagery machine, and it's very, very costly. We pray that the minister will approve for it to be bought so that we will not be taking hospital to another patients from here to another hospital for the MRI. Is very, very important. And the MRI machine is very costly for patients outside. But if peradventure we have it in this hospital, it will reduce costs for the patient and even reduce the burden of taking patient to look for elsewhere to do the investigation. And it is assured that Nohe will produce a very good result with the MRI machine.
Okay, ma, what is the impact of this visit on your department?
Okay. Today, the coming of the visitors to our hospital is a thing of joy, a very good thing to the hospital. Our department is one of the projects that he came to commission. Yes, we want him to witness the good environment, the good working environment which accounts staff of NOE has been enjoying, courtesy of our amiable medical director, Professor Emmanuel Iyidu, who made it possible for us and allowed us to pack in. We packed in last year, October, to the new building. And it is a thing of joy that we are now enjoying a good environment.
By the grace of God, we have a state-of-the-art radiology block, housing virtually all modalities in radiology except MRI. We have an ultramodern CT scan, 36 slices CT scan. We have 4 state-of-the-art color Doppler ultrasound machines. We have full digital X-ray machine. We have what's called computer radiography machine. About 4 of them. Then we have fluoroscopy machine also that is there. Of course, we also run ECG, procedures. So that's a very, robust, state-of-the-art equipment that we've got here to serve people. And this takes care of virtually all kinds of, ailments, investigations, ranging from orthopedics to plastics to neuro, cases, pathologies, pediatrics to obs and gynae, conditions like that. So there's virtually no kind of investigation that we don't do here at Nohe. Like I said, just MRI.
Okay, so what does today's visitation mean for your department?
Well, we have been eager to see the minister, come and see what we've been able to put together here and the services that we're rendering here. It's exciting when you know that your boss is coming to see the good works you've done, to be able to show what you're doing. But more importantly, to see whether, and trusting God that he's going to help us to acquire the only modality that is so essential here that we've not been able to get. That's an MRI machine. MRI is a magnetic resonance imaging machine, which we use here very, very frequently, and most of the times there are things we cannot treat without doing that investigation. So we are trusting that the Honorable Minister is going to help to open a door for us to be able to procure that machine to help serve our people better and the public at large. So that is that.
Yes, is the CBT Center is one of the many projects carried on by this administration under Professor E.C. Idobi. It was recently established. It is a 200 capacity CBT center meant for nursing, College of Nursing Sciences. Shall be using that place for exams, as in line with the requirements for council exams, nursing council exams, and subsequent exams that will be taking place in National Orthopedic Hospital. It is a paradigm shift from the normal way of writing exams, which is through manual. But this time, our exams shall be automated, and it is an improvement in trying to add ICT value to operations of this National Orthopedic Hospital.
Okay, please give us a brief background on National Orthopedic Hospital.
Okay, National Orthopedic Hospital is involved in taking care of patients in orthopedics, plastics, and not only just taking care of patients, we also have our training departments, like we train the resident doctors, nurses, and orthopedic cast technologists.
Okay, what is the hospital's expectation for the minister's visit today?
Okay, the expectation, we want him to see how far we have gone in infrastructure development, and we're also seeking ways of how he can help the hospital move forward.
The National Orthopedic Hospital is one of our flagship orthopedic hospitals in the country, and it has a very central role in the health agenda of the country. I'm sure you know that quite a number of people travel out for medical tourism. Quite a number of them go for medical services. So within that context, and the agenda of President Bola Ahmed to reverse the direction of medical tourism from outbound to inbound, this hospital has a very, very strategic role to play. And I'm happy that the management and the staff are able to maintain the ambience of the hospital. I love the level of greenery that I saw. Yes, this is not a purposeful use of medical hospital. I think they are making use of what they have, deliver what they make best use of it. So by and large, the National Orthopedic Hospital can only continue to grow better. We're happy with what is being done in terms of delivering services to Nigeria. But of course, it's not yet good. There's still a lot to be done. I've looked at some of the challenges that need to be addressed by government. I'm using this opportunity to show Nigerians, especially people of Benin, that the federal government under President Bola Ahmed takes priority in the health of Nigerians. Try our best to ensure that those gaps are filled.
With what you have seen here, what are we expecting from the federal government to, in addition, or just to address the challenges you've seen so far?
Well, first is that I've looked at the EMR system, the electronic medical record system. A few weeks ago, we sent a team here from the headquarters to do an assessment. So the government is going to support the hospital with hardware infrastructure, and also look at the current software they're using. If there's a need to upgrade, the government will upgrade it. We have also noticed the challenge with respect to power. Government is convening a national dialogue on power in the health sector, which is going to help hospitals like National Hospital to assess resources, assess expertise to provide palliative power for the hospital. Challenge of manpower, of course, is being addressed on a continuous basis. We are able to recruit health workers to fill whatever gap that is created. The government is prioritizing the welfare of the workers. You know that the president has increased the retirement age for clinical health workers from 60 to 65 years as a sort of incentive to retain more health workers within the system. So all this we're doing to ensure that we're able to address all the challenges that we face.
Some of the palliatives, there will be an improved health care delivery.
I assure you that definitely the electronic medical records that we are deploying is not just for services, it's for quality service. We're going to be using digital technology to measure quality of service, to rate hospitals, to standardize services, so that at the end of the day, even Nigerians who patronize these places can have a voice in rating the services they receive, and we can use that to evaluate what they're doing in the hospital.
Some of the facilities here are being powered by part of the private sector institutions. What's your call to other private sector and institutions as regards partnering with government institutions like this? And what did you see, or what is your impression about the partnership?
Well, private participation is very important. Government cannot do it alone. When I was going around, I saw some of the buildings that were donated by private philanthropists. We also want corporate organizations, non-governmental organizations to come forward, donate, partner, even if it's going to be on a business model. Some areas can be outsourced on a business model and the price still within reasonable control. So we encourage private participation in the healthcare system, and we know that Mr. President is a champion of private participation. So definitely this is one area that
Lastly, sir, in respect to the last vacant room we entered, the MRI, is the hospital expecting a response from the ministry, sir?
Well, I've looked at the request with respect to the need for an MRI machine. I agree with the MD that MRI machine is a very important need of an orthopedic hospital. We'll try our best as a government to support that need as much as possible.
All right, thank you, sir.
Thank you, sir.
Yes, yeah. Daalụ, ndewo, nnọọ. Ala Igbo dị mma. Daalụ na ịbatara ala Igbo. Bịa mere ndị Igbo ihe ọma.
Thank you, ma. Yeah. Okay, ma, kindly help us welcome the minister in your dialect.
Minister, no.
No.